OSHA defines bloodborne pathogens as infectious microorganisms that are present in human blood and can cause disease in humans. These potentially life-threatening pathogens include, but are not limited to, the hepatitis B virus, HBV, hepatitis C virus, HCV, and the human immune deficiency virus, HIV. Both hepatitis B and C affect the liver and can cause illness that lasts for a few weeks. However, 15% of Hep B and more than 50% of Hep C infections lead to potentially fatal conditions, such as cirrhosis or liver cancer. HIV attacks the body's immune system and destroys disease-fighting cells. It can cause the disease known as AIDS, for which there are no cure. In this video, you'll learn the best ways to protect yourself and avoid exposure. The CDC estimates 5.6 million workers are at risk of occupational exposure to bloodborne pathogens. Occupational exposure refers to the contact with blood or other potentially infectious materials, or OPIM, that may occur while doing your job. This contact can occur through the eyes, mouth, other mucous membranes, non-intact skin, or through parenteral piercings of the skin by needle sticks, human bites, cuts, or abrasions. Other OPIM include body fluids that can contain blood, saliva in dental procedures, all body fluids that are difficult to identify, and cells, tissues, or organs from humans or infected experimental animals. At-risk healthcare workers are dentists, doctors, and nurses, but there are many other occupations that are also at risk. Coroners and funeral directors, correctional, daycare, senior care, and hospice workers, emergency and first responders, laundry service and maintenance employees, and research lab scientists. Many people carry bloodborne pathogens with no symptoms and don't know they're carriers. Because of this, the CDC recommended universal precautions, treating all blood and OPIM as if they were infected. Let's look at some estimates from 2019. 58 million people worldwide were suspected to have had chronic hepatitis C, but 43.5 million, or 75% of those cases, were undiagnosed. It's estimated that 1.1 million people in the US had HIV, but 165,000, or 15% of them, were not aware they were infected. In 1996, OSHA expanded universal precautions to include additional OPIM, hand hygiene, personal protective equipment, and safe injection practices. This is now called standard precautions, which is what is used today. Engineering controls are products and equipment that can eliminate or minimize your workplace exposure. Contaminated sharps include any contaminated object that can penetrate the skin, including but not limited to needles, scalpels, broken glass, broken capillary tubes, and exposed ends of dental wires. Safer controls can help limit risks. Controls such as proper sharps disposal containers, self-sheathing needles, injury protection sharps and needleless systems, appropriate containers for storage, transport, shipping, or disposal of blood OPIM. Containers must be marked by a biohazard symbol on a red or red-orange background. Work practice controls are procedures that can eliminate or minimize your risk of exposure. Here are some examples. Never eat, drink, smoke, apply cosmetics or lip balm, or handle contact lenses in any area where the possibility of exposure exists. Do not place food or drinks in refrigerators or freezers, or on countertops and shelves where blood or OPIM are kept. Avoid the recap mishap. Never bend, break, recap, or remove contaminated sharps. Know the location of the sharps disposal container before you use a needle. Nearly 1/3 of all sharp injuries occur during disposal. Follow proper procedures for handling and disposing of contaminated specimens, laundry, and other potentially contaminated items. Place used PPE in designated containers for storage, washing, decontamination, or disposal. And be sure to wash your hands as soon as PPE is removed. Wear gloves when cleaning any blood or OPIM spills. Use a bleach dilution of 1 part bleach to 10 parts water, or an EPA-registered disinfectant specifically proven effective against bloodborne pathogens. The Hep B virus can live outside the body for up to 7 days. If employees have reasonably anticipated occupational exposure to blood and OPIMs, employers must comply with the OSHA's bloodborne pathogen standards. Your employer will create a written exposure control plan that includes a list of jobs with potential exposure and their procedures. OSHA requires this plan to be made accessible to all employees. It must also be reviewed and updated annually. Input from non-managerial employees who can offer valuable frontline perspectives, research of current market availability for new engineering controls, and a review of work practice controls. All employees are offered a free hepatitis B vaccine within 10 days of the initial job assignment. Unfortunately, there's no vaccine to help hepatitis C or HIV infection. OSHA also requires employers to provide, repair, clean, and replace effective PPE as necessary, and at no cost to the workers. PPE includes eye protection, gloves, gowns and lab coats, face, head, and foot coverings. Employers will ensure adherence to engineering controls, work practice controls, and standard precautions. Your employer will provide training when you're first assigned to the job, every year thereafter, and when new or modified tasks are implemented. Employers are required to maintain medical and training records and a Sharps injury log. If you're potentially exposed to a bloodborne pathogen, wash your hands and other affected skin with soap and water immediately. Flush your eyes, nose, or mouth with water if they were splashed or cut. Immediately report any exposure to your supervisor. Your employer will create an exposure incident record documenting the incident location, procedure, your training, and the controls and PPE that were used. The name of the individual who potentially passed on the virus will also be included unless prohibited by law in your area. Your employer will offer a free hepatitis B vaccine if you refuse the first time it was offered. He or she will also offer to arrange a free post-exposure evaluation, follow-up, and counseling. See a healthcare professional to get tested. The evaluating professional will provide your employer with a limited, strictly confidential opinion in writing. If an infection is detected, start treatment immediately. You should continue to watch your symptoms. The symptoms for both forms of hepatitis include fever and fatigue, loss of appetite, nausea or vomiting, abdominal or joint pain, dark urine, clay-colored stool, and jaundice. Only 30 to 50% of people with hepatitis B who are 5 years of age or older will develop symptoms. People with hepatitis C infection who do develop symptoms will typically notice them 2 to 12 weeks after exposure. HIV symptoms typically occur within 2 to 4 weeks after exposure. Look for fever and chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. Here's what you can do. Unless advised otherwise by your physician, get a hepatitis B vaccine to protect yourself from infection. Get tested for hepatitis C. Treatments can cure most new infections within 8 to 12 weeks. Get tested for HIV. Treatments are available that can help manage and control infection, often within 6 months. We covered the key points in OSHA's bloodborne pathogen standards, including engineering and work practice controls, standard precautions, employer responsibilities, and what to do if you're exposed. Hopefully, you found this video to be full of good information to help keep you safe on the job.